Hi, I'm Chris Salisbury, a Professor of Primary Care at the University of Bristol, and I'm going to be doing a quick demonstration of the Bristol Continuity of Care calculator. Now, I think that continuity is really important, and what we needed was a simple calculator which could calculate a range of commonly recommended continuity scores at a practice level. Because if you want to improve something, you have to be able to measure it, and at the moment that's not easy. We wanted something that could be used in any general practice that's got a system that could export data about their consultations. That wouldn't require them to install any special software or share any data. We decided to do it in Excel because pretty well every practice has got Excel, but we wanted something that would work on just about any version of Excel. The process is quite simple. First, you have to register on our website. And you click the button to register, and that means you provide us with your email address and you read the terms and conditions, and then we send you an email which will include the information you need. And what we send you are three things by email: the calculator itself, a user guide on how to use it, and a search file that you use in your system to extract the consultation data. Now, we've done it initially in EMIS, and I'm going to demonstrate EMIS to you, but the same concept could work with other systems as well. And in that email, we'll also ask you if you'll consider sharing your results with us, because so that we can eventually provide benchmarks for what's normal, what's the range of levels of continuity scores, and also we can show how it varies in different types of practices. The first thing you will need to do is to run the search in your practice system. Now, the search, first of all, takes a 1 in 4 random sample of your patients, and that's because that's still a lot of patients with an awful lot of consultations and plenty to get a good estimate of continuity. If you take the whole practice population, the number of consultations would be enormous. So it's a 1 in 4 sample of patients and their consultations over the last 2 years, because we know from previous research that you need that sort of length of time to get a really stable estimate of continuity. But what do you include in the measure? This is really key, and it's a key part of the process. We decided that you need to identify consultations where continuity really matters. Because if you extract what appear to be consultations from the GP records, it includes many things that aren't actually consultations but appear on the consultation screen. And we decided that continuity really matters when it's with a GP and when it's a true consultation, either face-to-face or by telephone or by video or on a home visit. So we exclude lots of things that also appear on consultation screens, like administration notes and letters and online triage and text messages. Now, these are all subjective decisions based on our experience, but we wanted to focus on the situations when we think continuity matters most. So this is the Bristol Continuity of Care calculator, and you can see it's got 3 main tabs: instructions, input and results. On this demonstration there's a 4th tab, but that's just for the purposes of this demo, as you'll see in a minute. So there's a very brief set of instructions on the first tab, and if you're familiar with how to import and run a search in EMIS and you're vaguely familiar with Excel, these are probably all the instructions you need. But if you need more help, then the user guide shows detailed instructions complete with screenshots. The user guide also tells you more about the different continuity results and what they mean and how they should be interpreted. So basically you need to run the EMIS search and run the EMIS search, and you get an output that looks like this. So it has 5 columns: the EMIS number, the name of the usual GP, that's the GP listed as the usual GP on the record system, the details of the person who did the consultation, each line is a consultation, the date of the consultation and the type of consultation. There are some blank lines, and these are patients that are in the system but didn't have any consultations in the 2-year period. So you have this, and in this little demonstration file there are 17,000 lines of data. And you have to select the data and copy it. And then you go to the input page and you paste it. And there are a few seconds to across. Takes 2 or 3 seconds, and that's done. And if you were not using EMIS but using System 1, you would tick this box, but we don't need to do that today. And then you need to refresh the results, and that does all the calculations. And you do that by going to Data and Refresh All. I've also put a shortcut to that in my quick access toolbar. So that's done all the calculations now, and then we can see the results. And this is what the results sheet looks like. It starts by highlighting who's included in these results, and most of the statistics you'll see below are based on patients who've had at least 2 consultations over 24 months. We do that because if patients have only had 1 consultation, for them continuity is a fairly meaningless concept. So we've included people with at least 2 consultations, and in this sample, remember it's a 1 in 4 sample of the practice population. There were 2,337 patients, and they had a mean consultation rate with GPs of 3.66 per patient per annum. And what you can see are 4 different statistics. The Bice-Boxman Continuity of Care Index is a good general purpose index which works well where you have continuity from perhaps 2 different doctors in a buddy system, or in 1 doctor or a small micro team. The usual provider continuity index, the main advantage of that is it's easy to understand, which is what proportion of all consultations were with the doctor seen most often. And then the SLIC, the St Leonard's Index of Continuity of Care, which is a measure which says what proportion of consultations were with the doctor that's listed as the patient's usual doctor. And then the MSLIC, which is a newer measure, not yet published, but is, instead of saying, as the SLIC does, what proportion of consultations were with the patient's named registered usual doctor, but instead it says what proportion of consultations are with the doctor that's been seen most often over the last 2 years. So that's called the modified SLIC. So we provided those 4 figures, and for each figure shown the score and the confidence interval and the number of patients that contributed to that score. And our default is to have all patients with 2 or more consultations over 2 years. But we have also added a couple of other options. One is to focus on frequent attenders. And I just need to refresh after changing any options, because some practices want to particularly focus on the people who come most often. So now it's looking at patients who've had 10 consultations or more over 12 months. And you can see the continuity scores for them as well. The number of patients contributing is a lot smaller. And then a third option is patients just based on the last month. Now the only relevant scores for here are the SLIC and the MSLIC, and that's saying over the last month what proportion of consultations for the SLIC are with the registered usual doctor. But for the MSLIC, what proportion of consultations over the last month were with the most seen doctor, and that's the doctor who's been seen most over the last couple of years. Now the advantages of those measures are that if you want to monitor change over time and you want to see the effect of a change in your policy, other measures like the COC and the UPC, it takes a long time for them to change, whereas here you can quickly see change very rapidly and you can monitor change each month. So these are 4 useful measures that will cover most kinds of practices and most situations. And there's a few notes here about the pros and cons of the different score. They're all useful in different situations. And if you read the user guide, there are more detailed notes. So that's it in a nutshell. We suggest that you rerun the search in your practice system every month or perhaps every 3 months, and then you can feed the results into the calculator and see how your scores change over time. So that's the calculator, and I've shown you how it works with data extracted from EMIS. Now we've also been working on a similar system for System 1 practices. It's a bit more complicated in System 1 because you can't do a search that extracts particular sorts of consultations. So we have to do an extraction of all consultations in System 1, and that's a very large number of lines of data. So we've created a conversion tool where you copy and paste in your data from System 1. Our conversion tool selects out the true consultations that are GP consultations and that are face-to-face or telephone or video or home visit consultations, and then it saves them in the format that's needed by the calculator, and then you can use the calculator exactly as I've shown before. And we're interested in doing something similar with any other GP computer systems, either pasting the data directly into the calculator if they can create data in the right format, or if necessary making a conversion tool. Now there are some other things you can do with our calculator. I know that many practices will be interested in identifying particular groups of people who, because the GP contract talks about identifying groups of people who most benefit from continuity. Now you can do that with the calculator. You could use it with particular segments of the population, such as people with multiple hospital admissions or older people. You just have to edit the EMIS search file to only select that group of patients and then export their data and then run the calculator. But personally, I prefer a simpler approach because all the evidence about the benefits of continuity is in general. It's not for any particular group of patients. So there you have it. I hope the calculator is useful. Please get in touch if you've got any questions. You can see our email on the screen there. And we hope that you'll be willing to share your results with us in due course, which we would of course keep confidential, but they'll be useful in terms of setting benchmarks so that you can compare your practice with others. I hope that's useful. Thanks for watching.